I would summarize the most important new developments in the treatment of androgenetic alopecia in 3 points. First of all, the use of oral minoxidil for androgenetic alopecia. It has been, in my experience, a complete revolution, especially in female patients. We use very low doses between 0.5 and 1 milligram daily in female patients and between 2.5 and 5 milligrams in males. The safety profile is really good. The most frequent adverse effects is the presence of hypertrichosis, but the effectiveness is really high. In second place, I would highlight the use of oral dutasteride in male androgenetic alopecia. It's a 5-alpha reductase inhibitor, more effective than finasteride for male androgenetic alopecia and with a really good safety profile. We use doses between 0.25 milligrams and 0.5 milligrams daily. And in third place, I would highlight the use of oral bicalutamide for female androgenetic alopecia. This drug is an analog of flutamide, but with much better safety profile. And we use doses between 25 and 50 milligrams daily in female with androgenetic alopecia. It's very effective and it also improves the seborrhea.